Hello, this is David Brown. I'm librarian here at Dalton State College, and today I want to talk about evidence-based medicine. Sometimes you'll hear the term evidence-based practice. They're very similar. Evidence-based medicine, the way I'm going to discuss it today, it refers to consumer health, the way you would search for information if you're researching a disease like pancreatic cancer, autism, or COVID-19. This is different than evidence-based practice, although they're very similar. Evidence-based practice is often a term you hear in the nursing field. It encompasses a little bit more than just searching for information, but applying what you've done into your practice. So we have really super great resources here at Dalton State. You're looking at the LibGuides, which is libguides.daltonstate.edu. And there is a really terrific LibGuide called Evidence-Based Practice for Nursing here. And there's also a very good nursing LibGuide. This would be of use to anyone interested in medical information, but it's especially designed for nursing students or allied health students. And this describes an overview of evidence-based practice. And you sometimes hear the EBP cycle, where as a practitioner, you're researching the best practice for a particular condition, and you start out by asking the question, searching for the information, critically appraising the information, implementing it, evaluating it, and it's like a cycle. And sometimes you'll hear the word PICO as well. That is an acronym we'll be talking about. But with evidence-based practice, we have this tutorial here set up, and there's an introduction, and you go through and you ask the question, and even setting up the question can be a bit challenging. And there's something called PICO format, in which you break down what you want to know by using information about the patient, the intervention, the comparison, and the outcome. So this would be particularly helpful to a student in allied health. Then you move through and search, and we'll talk about this. We have a great search tool, Galileo, which has a lot of databases. And then after you've found the information, and by the way, we'll talk about these three big databases, CINAHL Plus, or CINAHL Complete, as sometimes it's called, Medline with full text, Nursing Allied Health at ProQuest, and there's another one for consumers called Medline Plus. And we'll talk about the consumer health portion here in a little bit. So searching can be a challenge, and you can go through Galileo and find these databases. There's a little tutorial here in this particular LibGuide that can help you find your information. Then evaluating it, and this is what's crucial. You may have a great source, such as ProQuest Nursing or CINAHL, but even that won't automatically give you the answers you're looking for. You need to look at this pyramid and know the best quality of evidence is systematic reviews or meta-analysis. These are reviews of all the literature. And it goes down through, and all of these may come up in Galileo, but you can see that what you find in Galileo, every piece of information isn't the same as regarding quality of evidence. At the bottom, you'll have expert opinions, which experts are excellent sources, but that's not the best quality of evidence, though it could help you in your research. So this is a very important pyramid. And even for consumer health, there's something similar, where the very top is meta-analysis or systematic reviews. So this pyramid is really crucial. And then you apply, if you're a nurse in practice, you apply what you've learned. Then you assess. And there's an extra step often called share, which is really important. If you've gone through the process and you've discovered something that could be significant for others, you can share. And as always, you need to know about citing your sources. Now, and this is good information if you're an allied health or nursing student using APA. And we have another little tutorial here for that. So that's evidence-based practice, and I hope you'll take a look at the LibGuide. There's also evidence-based medicine from a consumer health perspective, and Medline Plus is a really great source for that. So what I want to show you now is Galileo, and when you're searching for evidence-based medicine or practice, you go to all databases, and you can do subjects, which is the quickest way, and you'll see a couple of big areas: nursing, allied health, which that would be evidence-based practice, and you'll see consumer health. Consumer health is what I'm going to click on now, and this would be for someone maybe researching a disease. Maybe they have a loved one who's been diagnosed with a disease, or they have been prescribed a drug and they want to find out more about its efficacy. You can go in here, and this has a list of our databases for consumer health. And probably one of my favorites is Medline Plus. Now this would be of use for the average person because this is accessible outside of Galileo for free. It also would be useful for someone in allied health if you have a general term you're searching like diabetes and you just want a really good overview. This is a really nice source. And what you're seeing here is the same thing a patient would see. You get full access to it. Everyone does. As opposed to a lot of stuff in Galileo that's just for students in the University System of Georgia. So it's fairly straightforward. You can search, or you can go straight to a health topic. And let's say you are searching for diabetes. You would just click D, and you see a whole lot of terms here. Now you could search for these or look at them alphabetically, but each term has a summary, and has a start here, diagnosis and test. All of this is very similar for each topic. And journal articles, clinical trials, so statistics and research. And this is all for educational use, so you can use it in a research paper. And it would be good for a patient researching a condition, but it'd also be good for a nursing student who just needs a broad overview, as opposed to a lot of stuff in Galileo that's more detailed. So that's Medline Plus. The Center for Disease Control is excellent as well. We have the Merck Manual. And these are things that are in consumer health. Now, I mentioned nursing and allied health. These would be more complex databases that would give you scholarly journal articles that would be good for research. And the three I recommend most would be nursing and allied health at ProQuest. We also have CINAHL, which is a little bit lower in the results here, but it's outstanding. The Merck Manual is here as well. And Medline. Now, I mentioned Medline Plus. That's based on a huge database called Medline, which is not just for nursing, but it's for medicine, allied health, and pharmacy, and medicine, biology even. And it's a really nice resource as well. So searching these databases can be particularly challenging. And as I noted, sometimes it's better for specific information you might need it for your classes. So I'll go ahead and do a search for pancreatic cancer treatment. This is particularly challenging. Some of these diseases that really don't have a cure, and from both a professional perspective and a patient perspective. So all of these databases in Galileo on the left side will give you an option to focus on just scholarly journals if you want, our full text, our peer-reviewed, and you can also filter by publication date. This would be crucial. Most of the time you want stuff in the last few years. There may be times where you're interested in information that's older than that, but it's important to know the date. And it's also important to remember what I showed you earlier. Systematic meta-analysis, these huge reviews of the literature are some of the best information. And usually you'll know those. That'll be in the title. And probably at the bottom, we mentioned opinions of experts. And close to the bottom would be one individual case, like one case study, or just a handful. So it's important to realize that when you look at these. Once you have found an article, you can click on it, and you'll almost always see some kind of abstract. And this is important. If it doesn't show full text, we can order it for you through Interlibrary Loan. And we have a more in-depth little video on how to search these databases in Galileo on the evidence-based practice LibGuide. But that's a look at ProQuest Nursing. We also have CINAHL and Medline. And I also want to show you information about, I want to show you some information that we have about evidence-based practice. I think we talked about that, and this is important as well. Websites. This would be a consumer health information, but it is crucial when you're searching for information that you know on the internet. You got to be really careful who runs the site. These are some questions you should always ask. What's the purpose of it? Are they trying to sell you something? Is it up to date? Do they have references? This screen right here is really crucial when you're evaluating websites. When you're doing Galileo, you pretty much you can pretty much trust what you're seeing in Galileo, but as I mentioned, there are different and with that pyramid, there are different areas of expertise, even in Galileo. But on the internet is where you have to really be careful. And this information here is really good to know. And for example, even on television, if you see a commercial about a drug or a disease treatment, these are important questions to ask. Just because they can afford a commercial ad, does that mean they're the best treatment? So I hope you'll have time to come to my workshop, in-person workshop on evidence-based medicine and practice. If you don't, please, you can email me any questions you have. But thank you for listening. My email is dobrown@daltonstate.edu if you have any questions. Thank you.